nagbabalik po ang Doctors on TV. Mga kasambahay, alam niyo ba ang August ay Breastfeeding Month? Kaya ang topic natin for this morning, breastfeeding. Before we go on, panoorin muna natin ang video na ito.
Tuwing buwan ng Agosto, isa sa mga pinagtutuunan ng pansin ng Department of Health ay ang pagdiriwang ng National Breastfeeding Awareness Month. Layunin nito na mas lalong mahikayat ang mga ina na mag-exclusive breastfeeding upang maging mas malusog ang kanilang mga sanggol. Sa umiiral na Implementing Rules and Regulations ng Milk Code of the Philippines, hinihikayat ang mga ina na magpasuso ng anak hanggang 2 taon. Ayon kasi sa mga pag-aaral, ang gatas ng ina ay nagtataglay ng mga nutrients na hindi matatagpuan sa infant formula. Ayon sa mga survey na ginawa ng World Health Organization, karamihan ng mga mommies sa Pilipinas ay nagbe-breastfeed 14 hanggang 17 buwan, lalo na sa mga rural areas. Nasa 58% ng mga ina ang nagpapasuso hanggang ang kanilang sanggol ay umabot ng 1 taong gulang, habang 34.2% naman ang hanggang 2 taon. Ngayong umaga, alamin natin ang advice at helpful tips ng mga eksperto kaugnay ng breastfeeding. Kasama ang mga expert, Doctors on TV.
At yan po mga kasambahay, ang topic natin for this morning, breastfeeding. Kaya kung mayroon kayong mga kilalang nanay o gusto maging nanay, gisingin nyo na para mapanood na ang topic na to. Of course, we invited our very special guest to join us this morning.
Okay, so we have a guest for today. She's a pediatrician. She's an international board-certified lactation consultant and a breastfeeding advocate. She's the chair of Breastfeeding Committee, Philippine Pediatric Society. She's also the head of the Lactation Center at the Medical City. She's the head of the Human Milk Bank in St. Luke's Medical Center, Global City. Let's all welcome Dr. Maria Cristina Cornelio-Bernardo. Good morning,
Good morning, Doctora.
Good morning.
Thank you for joining us on an early Sunday morning.
Yes, thank you for waking up so early, because we have a very important topic for today, na-underestimate natin ang benefits of breastfeeding, but I'm sure Doctora here will tell us all the benefits, for the mom, the baby, and the community.
So siguro, Doctora, let's start off. Why should mothers breastfeed their children?
Of course, because it's the standard and it's the norm. Normally, kasi for centuries, we've been advocating for breastfeeding, and we talk about it in terms of just the benefit, but it never really helped mothers with their decision to breastfeed. So now, what we want is to talk about the risk of not breastfeeding. So baliktad,
Okay.
So for the infant, for example, we go through it by system for IQ. So instead of saying that if you breastfeed, your IQ will increase 8%, baliktad. So since it's the standard, it's the norm, if you don't breastfeed, lower yung IQ ng bata natin, so mga babies natin. So for respiratory tract infection, we talk about it as risk reduction. So there's a risk of having the disease for about 63% for upper respiratory tract infection. For lower respiratory tract infection, yung mga pneumonia, 77% chance of getting that pneumonia if they don't breastfeed. So baliktad
77% higher chance of getting
yes. So for acute gastroenteritis, 63%. And then we don't talk about it only as risk reduction. Now what we want is for us to realize that it's also dose dependent, meaning the longer you breastfeed exclusively, the more that you'll get the benefit. For example, asthma, if you continue on to exclusively breastfeed for 4 months, you'll get that benefit. But if you continue on for about 6 months, then you'll get the protection against lymphoma and leukemia. So the longer you breastfeed, the more benefit that you get. So risk reduction and dose dependency. So we don't talk about it as benefits na lang na if you breastfeed, plus 8% ka. So baliktad na, since it's the standard, it's the norm. If you do not breastfeed your infants, mas mababa ngayon yung IQ ng bata mo. Yung potential for that child to have that IQ you're not giving.
So it's not just short-term benefits, but it's even long-term benefits in terms of
Yes.
intelligence and even cancer rates,
Yes.
Leukemia, lymphoma.
Lymphoma.
And then
Lymphoma.
that's just for the infant. So we have benefits for the mother as well.
Yes.
Such as, for example, acute blood loss, so lesser chance, so risk reduction, lesser blood loss, lesser your weight loss would be faster. So, mas mabilis pumayat yung mga mommies natin pag nag-breastfeed
Oo,
sila.
I use that to encourage mothers talaga, no? Kasi, di ba, kapag kapanganak mo, you expect babalik ka na sa dati, but you don't. So, ina-encourage ko sila, if not for your baby, for yourself, babalik, papayat ka kaagad.
It's a very good motivation.
Yes.
Yes.
And also
It
decrease
is.
in workload. So, less cleaning of the bottles.
Oh, okay.
You're sure it's clean talaga,
Yes,
no?
so, kasi when you
sterile.
wake up, you just latch on your
Right.
baby and then that's it. So lesser chance of that. And then diabetes also, risk reduction for diabetes, breast and ovarian cancer also for the mother.
What about breast cysts?
That
It
is
is
more of the
Protective, yes.
And it's a natural contraceptive.
correct. So
Breastfeeding.
98%. So it's
taas.
used. So it's called the lactation amenorrhea method. If you just breastfeed exclusively for 6 months and at night, and continue on more frequent breastfeeding, then you can use that as a contraceptive.
Both the mother,
Mother
And
the
the child.
both short-term
And
and long-term. Yun ang maganda talaga.
And for the family also, we have the benefits would be it's cost effective. So there was a study by presentation done by Dr. Willie Balzec of UNICEF when he presented the economics of breastfeeding in the Philippines. The money that they spent, a family, Filipino family spends on a formula, which is about 900 to 1,000 per can per week for spending for formula. They just allot it for medication. Cost, it benefits the family if a mother breastfeeds her child.
Parang nabanggit yun na rin yung mga formula milk. The Department of Health has a very strong campaign
Correct.
to really go for breastfeeding and avoid these formula milk to the point that they go to the hospitals
Yes.
to inspect kung merong hospitals na gumagamit ng formula milk. Ano yung take nyo on this or any comments nyo on this?
Well, we have nationally we have our executive milk code, national milk code, executive 51 during the time of President Aquino, President Cory Aquino. I'm
Okay.
sorry. And we have been trying to really implement this code because we have one of the best in the region. So our neighboring countries are actually following our lead. So there was a time last year when there was a lobby from Congress that they wanted to change it a little bit. No, but there was breastfeeding advocates who prevented them. So we don't want any change in the milk code because it's actually a very good law. So we have very good law on
So marami talagang benefit.
Oo, kasi it discourages bringing in formula and it will encourage the mothers to talagang try and breastfeed.
Tsaka maraming benefits pala, no? Economics, health,
Yes.
etc. etc. Ease also. Earlier, si Doc Steph mentioned about a bank, milk bank.
Yes.
Oo. Can we discuss the safety of the milk banks?
Well, now with informal milk sharing, what we want is to make sure that our mothers are safe. So we have what we call the National Milk Bank. So there's a group of pioneering milk bank in the countries. That's Philippine General Hospital, UPPGH, PCMC, and Fabelia. And then we put up this National Human Milk Bank Association so that we have a standard and of care and we screen our patients. So we make sure that the mother is protected from transmission of diseases. But of course, when you pasteurize, it eliminates this bacteria and viruses.
So, lahat ng available na milk sa mga banks are all pasteurized.
Pasteurized,
So,
yes.
safe yan na gamitin.
Yes, yes. Oo.
Okay. So bago natin ipagpatuloy no, ang ating very interesting discussion on breastfeeding, let us first watch Naturally Yours on supplements for the bones when you are breastfeeding to prevent bone disease.